Welcome everybody to today's webinar on unlocking potential, exploring the new frontier of secondary use of data in healthcare research. I'm Professor Carol Hodson and I'm the Executive Director of Monash Partners, and it's my great pleasure to bring this webinar to you today. I would like to start, if my slides actually move. I'd like to start by acknowledging the traditional custodians of the land on which we're meeting and standing today, and pay my respect in the spirit of reconciliation to elders past and present. And I'd like to extend my respect to any Aboriginal and Torres Strait Island people who are joining us today. Wherever you are, we acknowledge and pay our respects to our First Nations peoples. So we've got a terrific lineup of speakers for you today, and I'd like to take a moment to introduce them. Dr. Rhys Williams is from the Australian Research Data Commons, and he's going to speak to you about the HeSANDA project. We've got Dr. Lisa Exton, who is from CTIQ, who is one of our wonderful speakers and has a legal background, and she'll actually be able to speak to us about some of the legal implications of the secondary use of data. And we've got Matt Isaac, who is our wonderful superstar based at Helix Monash University, who is doing all the hard work to make sure that the data is available to us, through the Monash Partner node, which is a collaboration between Monash Partners and Monash University. So I just wanted to start by acknowledging the other research translation centres around Australia. We work in collaboration with 12 accredited Australian research translation centres and 2 more emerging centres, which form the Australian Health Research Alliance. And together we have enabled the HeSANDA node. So lots of the partners are working together to make sure that the use of data is streamlined across Australia. And I just wanted to acknowledge the hard work that's being done by the other centres. I also wanted to give you a quick overview of Monash Partners. We've been an accredited health research translation centre since 2015. We're a partnership between the health services, the teaching and the research institutes. And there are 13 partner organisations with 3 additional associate partners. And you can see all of our research partners there. And our main aim, of course, is to make sure that the fantastic research that's done in the teaching and research institutes is actually translated into health services to improve outcomes for consumers and the community and the people that we serve. So today we're talking about our commitment to data innovation, and I wanted to just mention that there is a national digital health strategy. Our ability to harness technology to analyse and understand data and to improve the quality and efficiency of healthcare is crucial. So Monash Partners continues to strive to improve health outcomes across our community through our data-driven innovation and care, and we have a platform which actually addresses this. So we're continuing to develop a collective vision around data for our partners and for our community, specifically opportunities to improve data quality, data sharing, data usage, harmonisation and linkages to drive better health outcomes. So you can see why the secondary use of data is incredibly important to our commitment to our data strategy. So within our platform, which is available on our website, I just wanted to say that, we've got a list of priorities, we've got leads and a steering committee. The Monash Partners Data Committee and in fact the ARA Data Committee meet regularly, and we have supported projects across our partners, essentially one of the main aims being that we can share data across multiple of our partners, and we continue to work to do that in a complex environment. So without further ado, I'm going to introduce our first speaker, Dr. Rhys Williams, who's from the Australian Research Data Commons. And Rhys, I'm going to leave it up to you to introduce a little further this topic and the great work that you're doing at the ARDC.
Thanks, Carol. I will wait for you to stop sharing, and then I can share my bit. Should be that one. Yeah, thanks, Carol. So I'm going to talk about ARDC. For those who don't know, I'll give a very brief introduction to us and to the HeSANDA project, a catchy little acronym, NOT. And then I'll talk a little bit about Health Data Australia, which is the product the platform that HeSANDA has built, that ARDC has built in partnership with Monash and the other HeSANDA nodes around the country. And finally, I'll give a little bit of a insight into some of the things that are coming that ARDC is working on, some with CTOQ, which Lisa will talk about, and some others that are in the pipeline, which may be of interest to people around this notion of sharing research data and secondary use of research data. I'm on Kaurna land in Adelaide, so I want to pay my respects to the Kaurna people, Niramani, which means welcome, hello in Kaurna language. So just briefly about ARDC. ARDC is an NCRIS facility, the National Collaborative Research Infrastructure Strategy. There are, I think, 28 these facilities around Australia, and unlike some that have the machines that go ping and telescopes and stuff like that, ARDC's focus is on the data that's generated by researchers. So we're part of that research data infrastructure, and that's not all about machines. It's often about people and partnership, as I'll describe. And the way ARDC as an organisation works, it's a member-based organisation. Our members are the 28 members of ARDC, which are universities and research institutes. And those people get some input into the strategy and shaping the future of ARDC. We have a board and a CEO, so we work similar to some of those government enterprises. Our CEO, Rosie, some of you will have probably met her on previous occasions. If you're not a member of ARDC and you want to be, if you're out there listening, you can, of course, contact us and join. Just quickly, the main, in a sentence, our purpose is to provide Australian researchers with competitive advantage through data. So make the very best use they possibly can of the data they have, and that's collectively, not just an individual, but across the country. And the way we do that is to bring together people, skills, data sources, related resources, training, storage, compute, all the sorts of things that make up the sort of data ecosystem. And importantly, they're not always technical things. And HeSANDA is a good example of that. The way we've organised ourselves internally is we have 3 thematic focuses. We have the People Research Data Commons, a Planet Research Data Commons, and a HeSANDA Indigenous, Humanities, Arts and Social Sciences. Obviously, the work I'm going to talk about fits nicely into our People Research Data Commons. But in fact, the HeSANDA project started before we had that structure. It in fact began back in 2020. HeSANDA was one of our really a flagship program in the health space as a long-term strategic partnership with the health research sector to build digital research infrastructure specifically to support finding and sharing the data from clinical trials. So that was in our planning. Initially, we decided we would advise that it would be good to focus on investigator-initiated clinical trials. It involves setting up a network of what we call nodes, and I'll talk about those nodes, Monash being one of those nodes. But not only building coding and building a piece of electronic infrastructure, but a lot of work around metadata standards, vocabularies, governance, and Lisa will talk a bit more about that work as well, policy work. The bottom line in terms of the infrastructure was we produced a product called Health Data Australia, which is the platform that I'll describe a bit more and Matt will talk about. This little joyful photo is the launch of Health Data Australia, which happened in July 23. And if people look very carefully, they can find Matt in the back row there. That picture was taken in Adelaide. And as you can see from that time frame, that was the culmination of work that started in 2020, co-design, establishment of the nodes with co-funding from ARDC. And the last line is just to say that the co-investment from ARDC and the nodes has been extended from that initial period, and it now runs through to the end of June 2026. And we're working towards making data sharing and the stuff that the nodes do really part of the business as usual, which it should be for research organisations. And these mysterious nodes of which I speak, this shows you who these people are. So in Victoria, there are 2. There's the Monash Partners and the MAC Clinical Trials Consortium at University of Melbourne. And you can see these are largely geographically based, as Carol pointed out, with the ARA translation centres. Not completely. There are a couple of networks that are more disease-based. There's a mental health node run out of Deakin, which has a national coverage, and there's a cancer cooperative trials group, which brings together the 12 disease-specific trial groups under an umbrella that's administered out of Melbourne, but it's a national activity. So that's hopefully very quickly ARDC, the People RDC, and HeSANDA as a program of work. The major output, of course, from HeSANDA was Health Data Australia, and this explains just a brief explanation, and Matt will talk a bit more about this, of how Health Data Australia works. So data providers, those of you out there who have done some research, you've got a data set from your clinical trial. You will have registered your clinical trial in ANZ CTR, that information about the trial itself, the types, the way in which it was collected, the patient cohorts and so on, will be in ANZ CTR. In addition, if you have a data set and you want to put it into HDA, you register that data set with DataCite, an organisation that manages metadata for data sets and issues a DOI, an identifier for that data set, not for the clinical trial information, but specifically for the data set. What HDA does is to automatically harvest the information from those two places and create a catalogue record in Health Data Australia. So that's metadata, not the data itself, that stays with you, but a catalogue entry, a metadata record is created in Health Data Australia. Essentially, that functions in two ways. It's a catalogue that you can search, and also if you find something, you can then request. So if you're a secondary researcher, the data user that we've on this diagram, they come along and they're saying, well, what data is available that could be of interest to me or could be of use to me for my secondary research? They can make a request. After searching the catalogue, that request goes back to the nodes, back to someone at Monash, for example, if it's a clinical trial that Monash has run. And then the node, the data providers, the data custodians assess that request, taking into account the way in which the data would be used, the ethics status, etc., of their proposed research. And if that request is accepted by the data custodian, and it's completely up to them, then the data is made available in a secure and ethical way to the data user, to the secondary data user. So that was like a 2-minute explanation of what took us a very long time to work out how to do, but that's how broadly how Health Data Australia works. And I've said this, but I'll say it again critically, Health Data Australia does not store the data. It's a catalogue entry, it's metadata. The data itself stays securely with you, the people that are the custodians of it. And I think that's an important point to note. So that's Health Data Australia is up and running. The website is working. It looks like that. It looks a bit like an online shopping site. You go in and type in a query and it returns information. For example, here's a study that's in HDA that's been generated from Monash University. You can read down. I won't give you a live demo. What's the rule? Never work with small children, animals, and live demos. So I'm not going to do that. But down the bottom, there's a lot of information. Is that what you want? If it is, you can click access the data, and you'll have to fill out a form. I don't know, Matt's going to talk about that form a bit. Important to note that anybody on the internet can search the Health Data Australia catalogue. So you can go in and anybody who's got internet access can search. They can see the information, the metadata about the clinical trial data sets, and there's 270 odd in there at the moment. What they can't do, every rank and file person on the internet, they can't access that data. They can't fill out a request form and it's say to log in. And to log in, currently you have to have AAF credentials, so Australian Access Federation, which means you have to be an employee or an affiliate of a university or research institute. There may be down the track other ways of extending that. I'm particularly mindful of those of you who are not employed by a university and don't have academic status, but actually as clinicians, for example, and I'm particularly thinking of allied health and nursing clinicians who may not have academic status, we want you to be able to access as well. So we're looking at other ways of satisfying those requirements for credentialing. But at the moment, it's AAF only. So that, I think that's enough about the sort of system. Matt will describe a little bit from the Monash perspective, how you can get involved in that. I mentioned the People ARDC Commons, or the People Research Data Commons, and I thought I would just briefly tell you the next kind of pieces in the puzzle, because the idea of this is to bring together that infrastructure, of which HDA is one piece, but there's some other bits that of course are important. The way we've organised ourselves in the People RDC is there's broadly four streams of work. There's the fair data assets. So these are making data assets like clinical trial data sets available to, findable, accessible, interoperable and reusable. And HeSANDA and HDA is part of that. We have just started an extension into cohort studies. So you remember that HDA currently is clinical trials only. But cohorts are an extremely powerful set of data as well. So we're starting, if you like, an extension to the HDA catalogue that would allow you to search for cohorts data sets. And we've even sort of thought, well, could we go into clinical quality registries? I put it up there a little bit provocatively. That is something we would like to do, but it's not something we can do tomorrow. We're going to concentrate, get the cohorts working, but that is on our sort of roadmap. And even administrative data sets in the health space from government departments could be introduced into the HDA catalogue at some point in the future. So that's sort of roadmap. We've got a stream of work that's looking at secure data access. So by that, I mean the data governance type of component about making sure access is secure and appropriately protected. Lisa's going to talk a bit about the work that we're doing in partnership with CTIQ around frameworks for data sharing, and that's part of that governance piece. But we're also doing some work on trusted research environments, things like Erica or SERP or Shore or Keypoint. You may be aware of some of those systems. They exist, but not everybody has access to them. And there are some nuances around how they can be used. So we're doing a piece of work around trusted research environments starting in the second half of this year. We've got a data integration strand. The most significant piece of that is the ARDN project, the Australian Health Data Evidence Network project, which also starts in the second half of this year. That is where you use common data models, common ontologies and vocabularies to make sure that the data you have in multiple places can be combined and have it research ready. The classic example is you have 5 hospitals, they have 5 different electronic health record systems, but actually the data is very useful research. How do you make sure that you can actually bring that data together in a secure way? The answer is you use something like OMOP or a common data model. So that's what that project will do. And that's going to be starting in the second half of this year, led by researchers at UniSA in partnership with ARDC. And finally, the other strand which is emerging is, which it has to be, is in the AI, the advanced analytics stream. And we've done some preliminary work around modeling and frameworks for example, distributed learning, leaving the data where it is, using it to train an AI without moving it, without compromising its security and its privacy. And there are ways of doing that. You don't have to move the data to the one place. You can actually do it in a distributed way. Those are the sorts of things that we'll do in that advanced analytics stream of work. So hopefully that gives you a sense of what ARDC is doing, both from what we've done so far with HDA, continuing to work with the nodes, but some other things that are coming up, which I think are the sort of logical extensions. A plug for our website, the People Research Data Commons. There is a part of our website which has that information collected together. There's quite a rich resources section on there with information about the tools we have, but also that other people are using. I'll encourage you to have a look at that. And also, I think I'd probably get the sack if I don't make sure that I tell you that we have our newsletter. But seriously, the newsletter is quite helpful, and I think most people will find it so. So please subscribe if you haven't done so. I would get the sack if I don't point out that ARDC is partly sponsoring International Data Week, which is a big deal. So it's a true international event. I don't know the last time it was in Australia. It was a long time ago. It's an important thing. It's happening in Brisbane in October. So those who were in the data science space and the health data space may be interested to attend that. And then finally, and I've run through this fairly quickly, hopefully not too fast, the contact details. So obviously you can contact me, but we have a generic HeSANDA at ARDC address. If there's anything in particular you would need to know, obviously there's a question session at the end, but anything else, please contact me. I think that's sufficient.
Thanks, Reese. That was fantastic. And I agree. I would highly recommend that people look at the ARDC website. This is an area that's moving rapidly, and I really value being kept up to date. So thank you. Our next speaker is Dr. Lisa Eckstein, and she's the Director of the Philanthropic Activities of Bellberry. A big welcome to you, Lisa. I think you're the Program Director of CTIQ, and that is clinical trials thinking smarter. And I think that's a terrific way for us to introduce you today. I think we all need to think a little bit smarter about the way that we conduct clinical trials. She has an adjunct appointment as a senior lecturer in the Faculty of Law at the University of Tasmania, through which she publishes on the regulation of clinical trials, genomic privacy and consent, and she has a particular interest in the development of effective and responsive governance strategies for health and medical research, including informed consent, data sharing, and safety monitoring. So you're a perfect speaker for us today. So thank you, Lisa, for joining us.
Thank you so much for the invitation. I'll just get myself set up with sharing my slides. Perfect.
And we're not seeing the slideshow. Yeah, that's it. Perfect.
Got it now? Perfect. There's always that moment of panic with technology, isn't there, where you think, is it going to work this time? It is so lovely to speak with you all, and so exciting to have so many people on this webinar, and I know many will watch it afterwards. I want to acknowledge I'm joining you from Kaurna land and pay my respects to the traditional owners of the land that I am on. I generally live, work and play on Cammeraygal land, and it is such a privilege to be able to travel this incredible country. As was mentioned, my name is Lisa Eckstein. I'm the director of the CTIQ program, which has had an ongoing relationship with HeSANDA and the ARDC over a couple of projects now, and I'm really excited to share with you some of the work that has been completed, some that's underway, and a number of pieces where I would love you to get involved and give us feedback so we can ensure that the work that we produce is as targeted to your needs as possible. For those of you who haven't come across CTIQ previously, we're an Australian not-for-profit member-based organisation, and we take on continuous improvement projects for the clinical research sector. We're up to our 12th clinical trial improvement project now. We were originally set up with the host of Bellberry Limited, which remains the substantive host of CTIQ, along with our founding members, ACTA, the Australian Clinical Trial Alliance, the NHMRC Clinical Trial Centre, and the George Institute for Global Health. And we also now have Medicines Australia and the Medical Technology Association of Australia on our executive committee, along with Anne McKenzie as our consumer representative. And what we seek to do is to work out from our members, we have about 55 member organisations in Australia now, what are the bottlenecks for clinical research working effectively? What is preventing you as researchers and other people invested in clinical research from protecting participants, doing your job efficiently and effectively? So I won't talk about many of these projects in detail at all, but I did just want to give you a sense of who we are and where we're coming from. By far our biggest project to date has been the Informed project, which was launched last year in June, which was the development of a consumer-centred participant information and consent form for clinical research, with the understanding that at the moment the consent forms and information sheets that are often used for clinical research are typically incredibly long, often over 30 to 40 pages, often filled with a lot of jargon, technical language, and often quite duplicative in the information that they articulate, which can make it really hard for participants to focus on the information that is important to them, that will allow them to make a really consequential choice, often at a time of great vulnerability. As we were developing this piece of work, we fortuitously began talking with Reese and others at the ARDC about including as part of the piece of work the development of a national data sharing statement to provide are legally and ethically robust, but also easy to understand and consumer-centred statement to allow people to make choices about the kinds of data sharing that they were happy for their clinical trial data to be put towards in the future. So I did just want to show you what that has come to look like. And obviously you're welcome to download the full template from our website and use it. I'd really encourage you to use it for your future research. But I just wanted to give you a sense of what it looks like, and hopefully you can see it's much shorter than information that's often included in PICFs at the minute, particularly where it relates to privacy and data sharing. It provides you as a researcher with options for the kinds of sharing choices that you'd like to provide participants with. And all of it is presented both in language that consumers can understand, as verified by a plain language expert, as well as with terminology that reflects modern times. So, for example, moving away from complete promises of anonymity to a more nuanced idea of keeping identifiers separate, protecting your information to the best of our ability. So please do go and take a look at that piece of work. You can access it from the dedicated Informed website, www.informedpicf.com.au, or access it through the CTIQ website, which will link you there as well. Now, as we came to be doing that piece of work with HeSANDA, a broader conversation started about governance frameworks for clinical research data sharing. And that led to the development of a bigger project that is underway at the minute, which is the Clinical Research Data Sharing Frameworks project. And I wanted to give you some information about what's included in that piece of work, where we are up to at the minute, and where there are still many opportunities to get involved. This project launched in the middle of last year in 2024 as a partnership between CTIQ and the Australian Research Data Commons, with the goal of developing resources for the research sector on ethics and governance issues related specifically to sharing clinical research data. I'll talk a bit about each of the 4 work packages, and I'm sure we'll have time for questions in the broader Q&A at the end of this webinar, should you wish. The first piece of work, which a draft work paper is open for feedback on at the minute, was developing a governance framework when it came to the legal and ethical responsibilities for sharing clinical trial data in Australia, because this can be quite a legally and ethically complex area. Because we're a federal system, we have different privacy laws in each of our states and territories, as well as at the Commonwealth level. As many of you would be aware, as clinical trialists, often you're subject to multiple sets of privacy laws. There's additional issues when you may be accessing administrative data sets. And of course, there's a national statement on ethical conduct in human research. So what this piece of work seeks to do is 2 main things. Firstly, give a really comprehensive breakdown on the legislative requirements that clinical trialists should be aware of when they seek to share their clinical trial data sets and when they seek to access clinical trial data from others, to ensure that everyone is aware of the responsibilities that they have in the landscape. We've also used it as an opportunity to synthesize 7 key principles for data sharing, to really put everyone on an equal footing about what's important when it comes to sharing clinical trial data in a trustworthy manner. The draft work paper is open for feedback until April 2025, so please do log on and take a look and send feedback our way. All the instructions for sending feedback are included on the draft work paper. To give you a sense of what's in there, as I mentioned, we have a breakdown of legislative responsibilities that is broken down by each jurisdiction. This is really to give you a sense of what's out there that you need to know about, not because it's going to be the complete, give you all of the analysis, because it'll point you towards the things you need to be aware of. We also have the 7 key principles for data sharing. Again, I'd be really interested in your views on whether these capture the things that are important to you when it comes to trustworthy data sharing. The second work package that we have completed now was a consultation report on the barriers and enablers to data sharing for people seeking to share their clinical trial data sets or access the clinical trial data sets of others. And thank you to anyone on the webinar who participated in this. It was really, really important and useful to hear perspectives from the sector on barriers and enablers in this space. And probably many of these will be familiar to you. I don't know that any were a huge surprise. When it came to enablers of data sharing, we heard a lot about the benefits of streamlining and standardization activities, as well as the importance of engaging early with ethics review bodies and consumers. And I really liked one of our participants who said, "I've flown from Queensland to WA to present to an ethics committee. I find it really helpful. People can see the whites of your eyes, which is a good thing for them. But it's equally good for us and our researchers because now you're personally accountable to the people you're talking to." And that kind of relationship building was really prevalent in the consultations we had, where people said that governance systems for data sharing were going well for them. But we also heard a number of barriers to data sharing. One of the key ones there was a lack of shared terminology. The fact, for example, that de-identified might mean something very different to researchers, to what it meant to data custodians, to what it meant to ethics committees. We also had a lot of duplication when it came to our governance frameworks, that still, despite many efforts to move beyond this, there were often multiple ethics review of the same application. At other times, there would be an ethics review of an application that had been approved, and then there would be a different pushback from the governance officer. All of these areas of duplication can delay research and cause frustration, particularly where applicants aren't necessarily sure why the duplication is there or why there's been different understandings of the acceptability of a research project. And of course, we heard about insufficient funding for data sharing activities that was often thought of as an add-on to research rather than as an integral part of it. Which leads me to the third work package, which is underway at the minute, and I'm really excited about because it's a methodology that hasn't been used in Australia before, that I think will be really important, both for this particular project, but also as a tool to use in the future for other questions. When it comes to the way our human research ethics committees are reviewing applications, one of the challenges that was brought to CTIQ from the ARDC when we were first conceptualising this piece of work was questions that had been raised by nodes about duplicative ethics reviews, but also variation between ethics reviews, where one ethics committee might say a particular sharing activity was ethically acceptable, another ethics committee might say it's not, one committee might say it's high risk, another committee might say it's low risk. And so we've set out to analyse that empirically. With some researchers from the NHMRC Clinical Trial Centre, we've developed a dummy application, which we invited all 200 plus Australian human research ethics committees to do a dummy review of. 32 of those committees have accepted the invitation and are currently undertaking a review of this application and will be providing us with a set of de-identified minutes, as well as answers to a short survey to give us a sense of both how they reviewed it. So did it go to a full committee? Did it go to a low risk committee? Was there another process for reviewing it? As well as their views on the acceptability of the sharing activity in accordance with the national statement, privacy laws, and so forth. We're hoping to be able to analyse the results from this in the next couple of months, and we'll be holding an in-person workshop in Sydney in August to feed back results to the sector and gain additional feedback. I will make available through CTIQ News Comms when that workshop is finalised in terms of both the date and location, and would love anyone interested in this topic to come along. Oh goodness. Sorry, PowerPoint just decided that it wanted to do some drawing on my slide instead of move to the next slide. Now, I just wanted to share with you why a process like this is important. And I think there's a few things about doing activities of this nature that can be really helpful in this space. First is for self-reflection among ethics committees themselves, who aren't generally given a lot of feedback on the way that they're doing reviews, except perhaps from NARCI researchers. It gives them a chance for self-reflection on how their review practices compare with others in the sector, which allows them to think about whether their level of risk tolerance, whether their understanding of the national statement, and other factors that might be influencing their review. It allows them to think about it, to try and assess whether they're still comfortable with the way that they've been reviewing these applications. It also allows for consensus building approaches for ethics committees to come together, as we're hoping to start doing in our August workshop, to reach shared approaches or interpretations so that when researchers apply to ethics committees in the future, hopefully those ethics committees are starting from some consensus position. And finally, another piece of the puzzle that we're looking forward to commencing later in the year is then being able to talk about areas of difference or divergence with consumers to get a sense of whether they have a particular understanding of the national statement that reflects one or more of the ethics committee approaches. That allows us to work out where the hotspots are, if you like, where consumer guidance can be most important. Our final work package for this piece of work, which we will complete by the end of October of this year, is a toolkit that brings together all of our findings from work packages 1 to 3 to have practical resources for the research sector. Many of these resources have been developed and identified through the consultation process, through the work we're doing with ethics committees, as well as through our advisory committee members. But again, please do get in touch with me through the CTIQ website if there's particular resources that you think would make your work most effective, and we'll do our best to consider them and see how they can fit with the resources that we're developing. But hopefully what's on the PowerPoint slide will give you a sense of the kinds of tools that we are committed to developing as part of this partnership with the ARDC. I just want to acknowledge the incredible project team that I'm working with, our methodology advisor, Beck McWhirter, our CTIQ research officer, Vanessa Warren, our legal advisor, James Scheibner, Gordon McGurk, who's familiar to many of you in the HREC space, and our NHMRC CTC colleagues, Lane Seidler and Aidan Tan, as well as Christian Kang and Armani Vudagos from the ARDC. Thank you so much.
Wow, fantastic, Lisa. What an amazing body of work. That's really interesting. I've got a million questions and I'll really look forward to seeing the results of the ethics committee review. That'll be fascinating. Thank you. We'll get to questions, and there actually already is one question, but I'm going to save it for the panel discussion at the end, if that's okay. And I'll just introduce our final speaker. So Matt Isaac is our Senior Project Officer at Helix Monash University. He specialises in research data management. He's played a key role in delivering secure and safe solutions for researchers with regards to data. For example, the deployment of the Monash Secure e-Research Platform, or SERP as we know it. And as I said before, Matt has been the powerhouse of our Monash node for HeSANDA. So Matt, over to you to wrap up the speakers. Thank you.
Thank you, Carol. Thank you, Lisa and Reese. Good afternoon, everyone. Thank you for being here today. My name is Matty Shack, and as mentioned, I'm Senior Project Officer at Helix. It's my pleasure to introduce you to the Monash node of HeSANDA and how we can support you in enabling your data sharing and collaboration. Today, I'm speaking from Naarm. I'd like to acknowledge the Wurundjeri people of the Kulin Nation, the traditional custodians of this land. I pay my respect to their elders past, present and emerging. Today, I'll talk you through the practical aspects of using the catalogue and how you can get involved as a data custodian or access data as a secondary researcher. First, I'll be mentioning Helix a few times today, so I'd like to first provide an overview of our services. Helix is a Monash research platform that supports data-driven research involving sensitive data. It is a uniquely university-wide capability that can provide web application development, data management, data analytics, hosting, and data transfer capabilities, as well as platforms such as REDCap and Monash SERP. So as a data custodian, how do you get involved? Firstly, by participating and listing your data, you have the opportunity to increase recognition and visibility for your research, helping to extend the life and impact of your work. So getting involved is quite simple. Just need to visit the Helix website and navigate to the HeSANDA page, and you will have the opportunity to submit a registration form. This will gather just basic information on the data set, key contact details, and the ANZ CTR trial ID number. The trial ANZ CTR website is key aspect of us being able to upload data to the Health Data Australia catalogue. So the only real major requirement is you submit the registration form and have the data set information registered on an ANZ CTR as well. From a practical sense, Monash Node will handle the rest of the uploading to the Health Data Australia catalogue. What that means for Monash Node is that we'll add some information to the dataset website. We have our a version of that at Monash University called Monash Bridges. We'll use this website to create a DOI, or digital object identifier. Once this is generated, this makes the dataset officially citable. Once we have the DOI, the dataset then appears in the Health Data Australia catalogue, where researchers can search, find, and request access to it. So to summarise, all we need from a data custodian is to have ANZ CTR registration complete, and then to inform the Monash Node that you'd like your Health Data Australia, your data set entered into the Health Data Australia website. We get a lot of questions about data safety, so I'd just like to re-summarise a few things we've talked about today. Data security is a top priority. Many researchers worry about losing control of their data, but HeSANDA ensures your data is never moved or stored outside of your control. As Reese mentioned earlier, only metadata, which is the descriptive information of the dataset, is stored on the catalogue. Data custodians also remain the gatekeepers. You decide who can access your data and under what conditions. This approach ensures your research remains secure, controlled, and ethically managed at all times. HeSANDA also aligns with national and institutional governance standards to ensure compliance with the best practices in data protection and responsible research. Now we'll just look at this from the perspective of actually accessing the catalogue and requesting data. You did see this briefly in the presentation from Reese. So you would basically seeing the same thing here again with an example data set listed on the catalogue. So for researchers looking to access data, you'd simply search for the catalogue online by using the term Health Data Australia, or you can navigate to the URL shown on the screen. The catalogue can be used by searching for any relevant terms to find any relevant data sets. A data set description, as shown here, is provided as long as with other information on the data set to help assist with identifying the suitable data sets for your research. Once a data set has been identified, a request for access can be submitted. These requests must include fairly detailed information. Now you can see here there's dataset details, applicant details, as well as some project information. So we're interested here in understanding project aims, hypothesis, and expected outcomes. We'll need to know ethics information as well, and the status of any ethics applications, as well as the plans for project outputs and any arrangements for any intellectual property that may be involved. This information is pretty crucial to ensure transparency and accountability, allowing the node and data custodians to assess the legitimacy and impact of the proposed research. So who actually reviews the data requests? When a request is first submitted, the Monash node will act as the first point of contact. We'll review and triage any requests to ensure they are legitimate, and then forward the request to the relevant data custodian. If needed, additional information may be requested from the requester, and that can go back and forth until you have the full information needed. The requester may also require in-principle support as part of any funding or ethics applications as well. Please remember, the final decision rests entirely with the data custodian. No data is shared without their explicit approval. Now, with I did mention already with the ethics, I'd also just like to remind you that this will also be included in that data request. If I go back a bit, this information is all included in the original request. There's several different tabs here, so you'll have all this information at hand as soon as the request is submitted. For resources and support, the Monash Node's built up a fairly large knowledge base on the Helix website, so we do encourage you to visit this for any of your HeSANDA needs. We can provide assistance with catalogue, integration and data access requests. We can facilitate the DIO minting requirements and management of the items listed within the catalogue. We can also have some templates for communications as well. So if you need assistance with communicating back and forth with requesters, we have some templates to help with that process as well. And finally, I'd just like to thank the HeSANDA team. I certainly got a lot of kudos earlier. Thank you, everyone. But I'd want to take the moment to thank our full dedicated project team. So David, Carol, Angela, Juliana, Marina, Kathy and Robab, who work behind the scenes to make this initiative possible. Couldn't do it without the whole team. Also like to thank all steering committee members and acknowledge our key node partners, Monash Partners, as well as the ARDC and all other HeSANDA nodes across Australia. If you have any questions or would like to get involved, we really encourage you to visit our website, visit the HeSANDA page and submit an inquiry to us, or you can submit a registration straight away. Otherwise, please get in touch with us directly. We'd love to hear from you, and I'd love to have a chat if you've got any questions about it.
Fantastic. Thanks so much, Matt. That's great. And just, you know, as somebody who's a regular user of SERP, I just want to say what a great system that is. My clinical trial data and some of our registry data is on SERP, and it just means that we can allow people to access it without any of the data being removed from the safe environment, which is, you know, means that we can allow international people to access our data, but they're actually playing within the Monash University environment, and we have all the permissions for what they're allowed to remove, including any reports. So yeah, Matt, I'm definitely a big advocate for the SERP environment, and we're very lucky to have HeSANDA linked with our safe haven.
Thank you, Carol. I should also mention I've kept SERP out of most of that, but the intention is that you know, to ensure the safety of the data when it is approved for sharing, that data would actually go into SERP. But that would be purely up to the data custodian to decide, but we do have that option as needed.
Great, thank you. We've actually got a question for you, Matt, so we might go straight to you. Related to your section of the presentation, is there a % of successful secondary data requests made to date?
Very good question. Look, we've only had one request so far. We've certainly not had many at all. So at the moment, that one's still in progress, but I don't see any issues with it. There has been a few with all the nodes across the country, and I believe they've all been successful.
Yeah, awesome. And it really is like a library catalogue, isn't it? It's just a place so that we know where the data is and people know what's available. I've certainly put my clinical trial data on the Monash node for HeSANDA. And yeah, I think that, you know, some international people know where to ask for data because they've read the paper and there's a data sharing statement within manuscripts. But I think this is a really lovely way to for people to be able to access it when, you know, they're looking for sources of large data. Yeah, I think it's terrific. Lisa, there's a question for you, and great work. How are ethics committees accepting your version of the PICF?
So my understanding from the feedback I've received is ethics committees are almost universally positive about it. The feedback we've received from ethics committees, researchers and sponsors that have used the template is that ethics committees are generally really excited about it. And a number of ethics committees have started requesting it. To the extent that we have had pushback on a template, it's come more from research governance officers than from ethics committees, where there's an element of unfamiliarity. So we've had a couple of instances with research governance officers that after an ethics committee approval have pushed back against the template. And that's something that we're working on because it's not necessarily the research governance officer role to do that unless there's some kind of legal concern, which we're not aware of. There is a subcommittee that's been formed of NMA, the National Mutual Acceptance Scheme, which is the interjurisdictional committee responsible for many of the ethics committees in Australia, that is with the NHMRC reviewing, taking the informed template to use to replace the current NHMRC or the current templates on the NHMRC website. And that's something that we're very much hoping will happen in the not too distant future. But in the meantime, there's been a significant voluntary uptake that we've had good feedback on.
Wonderful. Thanks, Lisa. Reese, I might send this question in your direction. First of all, there's a simple one and then a more difficult one. So first of all, do you want to just talk about, there's a question about whether HeSANDA is only for clinical trials data. And I think you did speak to that in your talk, but maybe just clarify.
Yeah, thanks, Carol. At the moment, the answer is yes, it is only for clinical trials data because that's where we started. But I think I said before that we are in the process of expanding that to cohorts. And there's lots of similarities between cohort studies and clinical trials, but there are also some significant differences, particularly around the conditions under which people participated. So consent becomes a bit of an issue. And also at the time, and these are growing data sets, which is not the normal way in which you would mint a DOI for a data set. So that's in progress. And I think we will move down the registries path. There have been a few people who have said, well, can you add biosamples? Can you add imaging? There's all sorts of things we could do. We would love to do. I think all of those things, because this is a metadata system and it's linking, are possible. The only things that I can say are on the roadmap are cohorts and registries at the moment.
Thanks, Reese. So the more difficult one, and I don't know, Lisa, you might want to add an opinion in here too. So, it's a really tricky issue when you've done a clinical trial and you haven't got consent for secondary use of data. So can you retrospectively add a data set to HeSANDA if you know the data was collected with participants where you didn't get consent to share the data for research reuse, and anyone looking at this project will know that you're unable to share the data. I can actually talk to how we've addressed that for our clinical trial, but maybe I'll let Reese, you speak first. And yeah.
I mean, Lisa can talk a little more from the ethical perspectives of waivers of consent effectively and things like that. But so you can still put, and we would encourage you to put your data set entry in the HTA catalog, even if you don't have, if the conditions under which you gain consent didn't allow data sharing at the time, because it makes it visible. People could still come to you and have a conversation about under certain conditions, could you use it? And what you remember, there's a data sharing statement in the ANZ CTR record. That data sharing statement and the details that end up in the HeSANDA record will indicate the conditions under which the data is or isn't available for sharing. So it would say, the details of what consent has been given will be included or should be included in that data, and whether or not it's available for sharing, under what conditions. That's part of the data sharing statement. So that information should be available and you can make the decision. How you actually do that, if you want to go ahead and make those retrospectively, that's more complicated.
Yeah, and I certainly know for our clinical trial, which was prospective consent from the next of kin with delayed consent from the participant when they were able to, because I do ICU trials, so it was delayed consent from the participant if they survived. But we actually asked for retrospective consent for secondary use of data sharing if it was de-identified data, and we had to be very clear about what our definition of de-identified was. And we were given consent from the ethics committee to share data if it was de-identified in that manner. Lisa, do you want to speak to this as well?
Yeah, so I want to separate out two things. One is if you have an original PICF that actually expressly precluded future sharing. So there are some PICFs that I've come across, particularly ones that might be 10, 15, 20 years old, where participants were told, we will not share your data for future research, or we will not share your samples or genomic information for future research. Where that is in a PICF, I would push back pretty hard against secondary sharing of that data because a promise has been made to those participants. Any sharing would have to be, I would argue, at a very aggregate level for that to be permissible. Yeah. Where PICF was completely silent on data sharing, that's quite a common situation. It's ones that ethics committees deal with not infrequently, and there is an express pathway for ethics committees to authorise what's called a waiver of the requirement for consent. And I think that's what Carol was referring to in the process that they went down. For that to be done, you would need, or the person seeking to share and the person seeking to access the data would need to essentially convince the ethics committee that a range of criteria have been met that mean that is substantially in the public interest for the data to be shared versus not shared. And there's a range of considerations that allow you to show that. Now, Obviously, it is best practice now to prospectively get consent for future data sharing. Anyone doing clinical research now should be thinking very hard about what consent to get for future data sharing. But that doesn't mean that legacy data that didn't have that consent is completely off limits. It means that where the consent is silent on future data sharing, you then need to have a conversation with the ethics committees and the data custodian to get a sense of what might or might not be possible with that data, and that will really depend on a case-by-case analysis.
Yeah, thanks, Lisa. And I certainly know it's changed our practice. So now all of our consent forms and protocols speak to future data sharing and you know how acceptable that is to the participants. Yeah. Great. Okay. Very articulate. Thank you, Lisa. So there's another really good question. And remembering that the ARDC doesn't own the data sets, they only catalogue the data sets. But the question is there a future hope to allow government policymakers access to the ARDC data sets within the legislative requirements? Rhys, over to you for that one.
I mean, so if a policymaker wanted to request access to a data set through HDA, they could do it the same as if they have access. They would do it the same way. They would have AAF credentials, I would imagine, and that would be assessed by the data custodians in the same way it normally would. Remember that we're not the repository, so it's not as if we're sort of making that available to the government. So the broad answer is yes. If they don't have the academic credentials at the moment, as I said, if they don't have an AAF credential, the AAF, by the way, isn't just, it is New South Wales Health, for example, have signed up to use AAF as a credentialing system. So if you're a member of New South Wales Health, you have AAF credentials, but the rest of it is for universities. That, as I said, that will change over time. As you can imagine, we have to get this right. Because we have to make sure that it works. We can't just have people log in with their Google password, for example, which some places would use, or your Apple password, whatever it is. It needs to go beyond that because you've got to make sure that person is who they say they are, which is a little bit more than just having a password and a username. It's a what do you call, what's the word? It's identifying the real person. I've forgotten the word at the minute. So at the moment, if you don't have academic credentials or feel that you are excluded from making a request, my suggestion is partner up with an academic colleague and get them to make it on your behalf, and you put your name in the request as well. But we will solve it down the track.
Thanks, Rhys. Terrific. And we've spoken quite a bit about ethical considerations, but what about regulatory considerations? And Lisa, do you want to speak for a moment about secondary use of data and particularly clinical trial data and any additional regulatory considerations that are separate to just ethical approvals?
Yeah, so the main regulatory considerations are going to come from privacy law. And so one of the things that I think is a really important moving space here is what we even think of as personal information, because I think that for a long time, researchers and many others have been of the view that as long as it's de-identified, as long as there's no names, postcodes, dates of births, and so forth, that we can quite comfortably consider something de-identified for the purposes of privacy law, or privacy law not applying to that information. And we're moving into a very different space. We're really moving into a space now where I would say almost any participant level data from clinical trials should now be considered identifiable. And that places us in quite a different regulatory space where researchers are going to need to be much more familiar with privacy laws and much more forward thinking in how they share data in a privacy preserving way. I did mention the pathways for waiver of consent under sections 95 and 95A of the Privacy Act. Those will apply to Commonwealth data. And many states and territories have their own privacy laws as well. So I would think that that is the regulatory space that is going to be really important and changeable at the minute. We know the privacy laws are under review at the moment, and it may be that we move in that review away from the dichotomy between anonymisation and non-anonymisation, and much more towards thinking holistically about good data management practices as the regulatory requirement for sharing, which I think fits really well with the approach that HeSANDA has taken. AI is also going to intervene in this space, and we're already aware of things like imaging results, for example, that might be completely de-identified, but with the advent of AI have become identifiable. So that, I think, is the regulatory space that is going to be really important. We also know that there are different regulations that apply to administrative data sets. Here is where data custodians are going to be incredibly important, and I won't try to speak to the complexities of the regulations that apply to administrative data sets other than to say that speaking to those data custodians really early is incredibly important for ensuring that the data sets that you're looking to combine with any clinical trial data are actually going to be able to be made available to you.
Terrific. That's really helpful. Thank you. I guess I've got, probably an important question, Reese, and that is like, what is the main barrier to people sharing their data on HeSANDA? Like, is it the fact that they haven't had consent, or is it more simple than that they're sort of worried about the control of their data and where their data is going and whatnot? Like, what is the main barrier, do you think?
Oh, and I think Lisa talked about some of the concerns that we brought to CTIQ. At the moment, I think the most significant barrier is governance, is for researchers to be confident that the ethical boxes have been the appropriate consent has been secured, and that they're not going to be breaching privacy or using the data for a way that the participants didn't want it to be used. There is significant concern about having the data used for commercial purpose. I mean, Lisa is aware of some, and many of you will be aware of this, that there's been a bunch of work done by CTIQ, done by ACTA around consumer views of data sharing. And to summarize, as I understand it, that there is majority great support for data sharing, for data to be used for research purpose, but much less support for it to be used for commercial purpose. And Lisa's mentioned AI, and AI is the sort of looming commercial application that's actually causing. So I think there's a lot of concern about that. Is it going to be even somehow in an unknown way be used for some commercial purpose? So that's a big concern, and that's not an easy thing to solve, but hence the notion of people needing to identify who they are, what their affiliations are. In that form, Matt mentioned you have to fill out a form making a request, you have to declare conflicts of interest. And so in there, the data custodian will receive information about this person, clearly the person making the request. So we would expect them to declare, for example, if they're on the advisory board of a biotech company or something like that. So those sorts of things are taken into consideration, but they are still barriers that people have. And the final thing I'd say, some people are concerned that their results will be stolen or somehow they won't be. The moral rights issue that, I've done this research, I've had it published, and I've been willing to put my data set there, and then someone else has taken it and got a Nature publication or a Lancet publication. I guess, to be fair, that's always been a concern in the academic world. It's always been possible that people would do that. I think our platform actually helps by documenting the flow of the information and the flow of the connections. So we've got some documentation of who it is who's applied and who's responded and how they've responded. So I think we can address that over time.
I think that's really important, because it's really not any different to, every time you publish, almost every journal now requires a data sharing statement and how you'd be prepared to share your data. So I don't see it as any differently, putting your, cataloguing your clinical trial on HeSANDA is the same as describing how you'd be prepared to share data, for a journal or for anybody else. And I think, if anything, we're very protected with the combination of the HeSANDA catalogue and the SERP secure platform, where people can't actually remove the data anywhere away from Monash. And, they have to have a clear hypothesis, and you can only make certain data variables available to them that address that hypothesis, and not all data variables, they don't have free access to your whole study. So I actually think it's an incredibly clever system that we have set up. So yeah, terrific. I think, there are some concerns around overcoming the challenges of cross-border data sharing and ensuring that data security and privacy, if there are different laws, privacy laws, for example, across different jurisdictions. Lisa, do you want to speak to that at all?
Yeah, look, there's absolutely different laws in different jurisdictions. I would say that the best way of dealing with that is really solid data sharing agreements, and that's something that HeSANDA has already been putting work into, and something that in CTIQ's current project we're considering further, because really under privacy laws, what you need to be able to show when you share across borders is that the people receiving the information are going to treat it at least to the standard of Australian privacy laws. And that's something that where contractual agreements can be really, really useful and important. The other issue we have coming the other way, though, is researchers overseas seeking to access Australian data, where, for example, in America, there's a very, very different threshold of what research needs IRB, their version of HREC approval, versus what's required in Australia. And that can create some bottlenecks the other direction too, where under American regulations, the project wouldn't need to go to an IRB, but often data custodians in Australia are really uncomfortable releasing data to an overseas research project that hasn't been through an equivalent of an HREC review, and that's a different kind of bottleneck that can arise. So both of those can be challenges with cross-border data sharing, but I would say from the outset, making sure that your research team or your institution has in place a data sharing agreement that is really attuned to ensuring that privacy standards are upheld no matter who accesses the data is going to be your best form of protection.
Yeah, fantastic. Thank you. You spoke a lot, Lisa. I loved your conversation about the different terminology and understanding of de-identification. And I just wondered, what are the limitations of current de-identification methods? And do we have emerging technologies that will help us with this? Or can you speak a little bit about sort of where you see this going in the future?
Gosh, I am sure that all of you on the call are more skilled at this than I am, other than to say that we are going to need to move away from de-identification being a process of taking information away to de-identification being a process of using proactive privacy enhancing technologies to ensure that what people are able to do with that data in the future has sufficient protections that re-identification isn't going to be possible. Now, obviously, secure research systems or trusted research systems are one way that we can do that by making sure that the way that people access data inherently doesn't allow them to take that data away and link it with other data sets. Then I know of other systems that are being used, say, for imaging data to introduce small flaws, if you like, in the system. There's different aggregation levels for genomic data. You can think about what depth of sequencing you're willing to provide. What I will say, though, is this is going to be a very, very new world for ethics committees. This is going to be something that they are not necessarily familiar with. And what I would love to see researchers do is really include in the applications that they submit to ethics committees and governance officers really proactive statements of how they've thought about privacy enhancing technologies and how they've thought about de-identification beyond just we're going to remove the identifiers, because that's both going to help ensure that the ethics committee feels confident that the researcher knows what they're doing, which we know is 90% of what an ethics committee wants to know. And we'll also start upskilling our ethics committees so that they become familiar with those technologies too, and are then in a position to be able to think about it as other applications come in.
Fantastic. All right, I don't see any more questions in the chat. And Reese, thank you. You've posted some great and useful links there. That's terrific. Is there anything that you wanted to add about de-identification or?
No, the only thing I've just been thinking with a few of the questions and thinking of Lisa's responses, when people say, they're critical of HeSANDA or HDA, it's not going to work for trials we didn't get consent for, and it's not going to work for the following reasons. So a lot of those things are true, but you remember, the way I remember this is that we're trying to change practice here. Building a system, however good it is really the easy part. And don't tell the programmers I said that. But the harder part is to change best practice, so that best practice becomes, as Lisa said, that upfront you will proactively consider, as a researcher, as an HREC, you will proactively consider all of these kinds of issues. You'll do your very best to make sure that you're putting in wording that allows for the flexibility of future data sharing, and that will become the norm. Now, we know it hasn't been the norm in the past, and we do have that pipeline of projects which are harder to deal with, and we talked about those. But what we really hope that people will do is get on board and make this really the new way of doing work and doing research, because we know it's going to be beneficial. But we've got a bit of a momentum to overcome, changing behaviour, and that's really, I want to sort of call out the nodes for that, because the way that happens is the network of people who are closer to the researchers, which is you guys. By partnering with you and by partnering with people like CTIQ, we can start to see that groundswell of support for the change. So hang in there and work with us, because I think eventually we will see that change. It is going to take a little while. And the final thing I was going to say on that is if you look at it from an international perspective, as you said, Carol, there's an expectation that people put their data, they make their data available from research. In the US, mind you, I don't know what things will change, but in the US currently, if you want to get NIH funding, you won't get your NIH funding unless you put your data, you make your data available. It doesn't mean it's freely available to everybody. It has to be available on a repository. And the many countries, Europe does the same thing, and the UK does the same thing. It's only a matter of time before that requirement will come in for the NHMRC, for the MRFF, and others. So really, again, the future practice will be that will be the norm and the expectation.
Yeah, I completely agree, Rhys. I actually do think that change is coming, and that there will be policy changes around data sharing in Australia that require us to make it available. Well, I think that I don't see any more questions. Lisa, Rhys, and Matt, this has been a great conversation. Do you have any last comments before we close out? No, Matt.
Just do the hard sell one more time. Call to action. If you are interested, even if you're not sure, just please reach out. Let us know. We can have a chat with you, and we can try and work through any solutions that you might be worried about. So yeah, thank you, everyone. Happy to support you where we can.
Thanks, Matt. Lisa?
I'll add my call to action. CTIQ projects are only as good as the contributions we get from the sector. So please do get in touch with me, send feedback, look at the draft documents on our website, because we're here to serve you. And the best way we can serve you is by understanding what problems you're facing, and also whether the drafts we've put out into the world would actually suit your needs or not.
Yeah, fantastic. Thank you. So on behalf of Monash Partners, Monash University, and HeSANDA, I'd like to thank everybody for joining us. I'd also like to say a huge thank you to the Monash Partners team who organised the webinar, to Victoria, Kathy, Angela, and everybody in our team. Robab, thank you so much. And David and Matt, really appreciate your support as always. Thanks, Rhys. Thank you, Lisa. It's been wonderful. A great conversation.
Thanks, Carol. Thanks all.
Thanks, everyone.
Everybody.